Welcome to our fourth Medvocate with Dr. Jaclyn Tomsic. My name is Kumar, and I'm the events co-director for Medvocate. So for those of you who are new, Medvocate is a student-led organization that is interested in connecting youth to medicine. So we hope to make the most out of any opportunity. So just a quick reminder, at the end of this, there will be a quiz and that will be sent out in our chat. So keep an eye out for that. And if you are not a member yet, there's a membership form that was sent out in our Slack group by Akila. So please fill it out. And so today our guest is Dr. Jaclyn Tomsic, MD, DMD. She is specialized in MFO surgery, general dentistry, and general surgery. She is here with us today to share some thoughts and knowledge about what it's like to be an MFO surgeon. So Dr. Tomsic, please feel free to start whenever you're ready.
Okay, you'll have to help me so I can share my screen, I guess, because I'm not really great at that.
Yeah.
So let's see.
That's perfect. Yeah.
Let's see. Okay. Now, well, look at that. I think it's working. So, all right. Well, hello, everyone. I want to thank Medvocate, first of all, for inviting me to participate and speak. So I'm just going to go ahead and get started. So as it was just mentioned, my name is Jaclyn Tomsic. I am a board certified oral and maxillofacial surgeon in Cleveland, Ohio. I practice within a group practice, including 3 other surgeons. I practice full-time in the group, and then I also am a part-time attending faculty with the Case Western Reserve University Oral and Maxillofacial Surgery Residency Program, which is affiliated with University Hospitals here in Cleveland. And I am also a fellow of the American College of Surgeons, which I obtained this in 2017. So, what is oral and maxillofacial surgery? So, as defined by our governing board, which is AAOMS, the American Academy of Oral and Maxillofacial Surgeons, oral and maxillofacial surgery and surgeons are the experts in face, mouth, and jaw surgery. So we treat disease, injuries, and defects in the head, the neck, face, and hard and soft tissues of the oral and maxillofacial region. So to break that down, oral obviously is mouth, maxillofacial part refers to the jaws and face. OMFS is an internationally recognized specialty, and we are considered regional specialists and who are qualified to treat the entire cranio-maxillofacial skeleton, which includes, as I mentioned, the mouth, the jaws, the face, the skull, and any associated structures. OMFS is both considered a dental specialty and a medical specialty. That can vary depending on the country you're in and sometimes even the state. So in the United States, it is a dental and medical specialty. In the United Kingdom, it is a medical specialty. So you can hear a lot of names. OMFS is probably the most common. We are also referred to as OMF surgeons, sometimes simply just oral surgeons or maxillofacial surgeons. So when you're speaking about us, all of these names are interchangeable, synonymous, and they are all names that we go by. So I thought that I would take a slide just to discuss the training, as sometimes it can be a little bit confusing. So typically anyone who is an oral maxillofacial surgeon has completed 4 years of college or undergraduate schooling. I personally went to undergraduate college here in Cleveland at John Carroll University. I was a major in chemistry and a minor in biology. I then went to dental school at Boston University. That's 4 years. I completed medical school. Typically, since we've already been to dental school, depending on the school and depending on the program, 1 to 2 years. We don't have to do the first 1 to 2 years. We can complete anywhere between 2 and 3 years of medical school, which is usually integrated either within our residency program or is completed immediately after finishing residency. Personally, I completed 3 years of medical school at Wayne State University in Detroit. So I completed years 2nd, 3rd, and 4th year of medical school. And then residency, as I said, it ranges from 4 to 6 years. So a 4-year residency program is a program that does not include medical school, whereas a 6-year program, which I usually talk more about because obviously that's the program that I completed, includes medical school. And that is typically, like I said, integrated into the residency program. Each program is a bit different. Their curriculum is a bit different. But no matter what program that you do complete, you will complete all of the qualifications and requirements for both medical school and residency. Interestingly, or another point about the 6-year residencies, they also include a 1-year general surgery internship year, which is integrated into the residency, where you are operating and functioning and working as a general surgeon. And then fellowship is like any medical specialty. It is after completion of residency. I mean, it is optional. Fellowship is definitely gaining interest, especially in OMFs over the last, I would say 10 years. But still, with that said, the majority of oral maxillofacial surgeons, I would say probably have not or do not pursue fellowship. In the next couple of slides, I thought that I would just kind of review and go over the scope of what an oral and maxillofacial surgeon does. The first thing is what we call dentoalveolar surgery. Dentoalveolar surgery is a surgery within the jaws of the mouth that the portion of the jaws which house the teeth. Most dental alveolar surgery include extraction of both erupted or impacted teeth and third molars, difficult extractions of teeth, as well as bone grafting and recontouring of the bone itself in order to prepare, for instance, for other oral surgeries or even dental surgeries. We also treat pathology on a pretty regular basis. Me personally, in my practice, I do a lot of pathology. I probably have at least 1 to 2 pathology consultations each week, and honestly, sometimes even more. And that does include both benign and malignant pathology. So benign pathology includes cysts, tumors, masses within the jaw and oral cavity, as well as on the face. These can be what we call either odontogenic, which means that they are originate from tooth structures, or non-odontogenic, meaning they don't, they originate from tooth structures. Most of our odontogenic or tooth structure tumors do involve the bone, as obviously the teeth are in the bone, whereas the non-odontogenic cysts and tumors can be anywhere within the oral cavity, both the hard and the soft tissues. And then, of course, malignant pathology most commonly is head and neck and or oral cancer. It could be cancer of the mouth, of the lips, and even of the skin. And what we do includes both resecting or cutting out the surgery, as well as followed by reconstructing the area. So facial trauma. So I consider facial trauma one of the hallmarks of my specialty. Every surgeon, every OMF surgeon is very well trained in facial trauma. It is a heavy part of our training. And I would say that any oral maxillofacial surgeon will treat facial trauma in some capacity throughout their entire career. So when I say facial trauma, so we treat fractures of the entire craniofacial skeleton. So this includes the mandible, which is the lower jaw, the maxilla, which is the upper jaw, the zygoma, which is the cheekbone, the nasal bone, the orbits, which is the bone around the eyes, and then the frontal bone or frontal sinus, which is your forehead bone. So we reconstruct these bones caused by many injuries of varying causes. We also see and treat many soft tissue injuries of the face, mouth, including very complex avulsions or abrasions, lacerations. All of that is involved in the hard and soft tissue trauma that we see on a regular basis. Another very near and dear topic of surgery to me is orthognathic surgery. I did one of my fellowships a year long doing just orthognathic surgery. And that is what we refer to as the jaw repositioning surgery. And we do this surgery to correct conditions of the jaws and face that are related to growth, structure, skeletal disharmonies, TMJ, as well as sleep apnea disorders, and orthodontic problems that cannot be correctly treated with just orthodontics or traditional braces alone. All right, so continuing on, I mentioned TMJ. So TMJ is the temporomandibular joint, which is the jaw joint that opens and closes your jaw. So there is both conservative, non-surgical, as well as surgical approaches to treatment of TMJ. And I would say that OMF surgeons are probably the only specialty that exclusively surgically treats TMJ disorder. So there are many other specialists, ENT specialists, many dental specialists and dentists non-surgically treat TMJ with different appliances or mechanics or even exercises. But oral surgeons we are really the only people that treat TMJ surgically. And this can range from minor procedures in the office that include just washing out the joint or injecting steroids into the joint, to major, procedures that include complete total joint replacement of the TMJ, which is just like if you're replacing a knee or a hip. We actually have a replacement joint for the TMJ. So that's something that kind of sets us apart. Next, OSA, which is obstructive sleep apnea. So this is also a very important disease entity that overlaps between many specialties. And again, this is something that can be treated both surgically and non-surgically. There's no black and white way of treatment for OSA. That's why there's so many options. As an oral maxillofacial surgeon, I personally concentrate more on the surgical treatment of sleep apnea. So this would include what we call maxillomandibular advancement surgery, which is very similar to orthognathic surgery, where we cut the jaws and move them forward in order to create and open up the airway and essentially cure sleep apnea. We also perform something called genioplasty, which is similar, where we move the chin forward. This also helps to open up the airway and can help improve sleep apnea. And we work when we're doing sleep apnea surgeries, this is where we work very closely with other sleep physicians as well as sleep labs. So facial cosmetic surgery or facial aesthetics. This is also something that overlaps many surgical, medical, dental, all kinds of specialties. There are many people doing this type of surgery. And I called it facial cosmetic surgery, but there are both surgical and non-surgical approaches and options for this. So I've listed the most common surgical facial cosmetic procedures. And just to kind of, I'll go through those quickly, just so you kind of have an understanding, and understand what they are. So blepharoplasty is eyelid surgery, usually upper, lower, or both. Brow lift is eyebrow lift, and this can be done either directly or what we call endoscopically. Rhinoplasty, septoplasty, that is what we refer to as a nose job. Rhinodectomy is the medical term for a facelift. Otoplasty is repositioning, recontouring, restructuring the ears for cosmetic reasons. Facial augmentation is a very interesting aspect of facial cosmetic surgery, and it is essentially placement of prosthetic implants to augment the face and create better contours and a younger looking face. Essentially, any bone in the face now, essentially, you can either find a custom or a stock implant. The most common bones in the face that are augmented include the cheeks, the chin, and the mandible, the lower jaw. Genioplasty, something that I touched on with regard to sleep apnea, that is, again, recontouring, repositioning of the chin for cosmetic purposes. Liposuction of the neck, it's pretty self-explanatory. Oculoplastics is actually something that's very also dear to me. I spent a lot of time training with an oculoplastic surgeon. They are actually their own specialty, subspecialty within ophthalmology. But as maxillofacial surgeons, both in trauma and cosmetically, we work very closely with oculoplastic surgeons, and there are a number of procedures that we overlap that both of us do on a regular basis. And again, that includes any surgery around the eye or the structures around the eye. Now, obviously, as an OMF surgeon, I do not do any surgery directly on the eye. That is, I refer that to the ophthalmologist. So, and then non-surgical rejuvenation, I'm sure, again, very popular. You see it everywhere, are basically injectables, the most common being Botox and fillers. And you can find people anywhere between from a gynecologist to a neurosurgeon to myself, PAs, nurse practitioners doing Botox and fillers. So obviously there's a very big market for this everywhere, but we do it too on a regular basis. And it's something that I also enjoy doing. Chemical peels is something that I also do, obviously not really as popular as Botox and fillers, but it is still an option. Cleft and cranial facial surgery. This is actually a specific fellowship that is available after residency. It's usually a year-long fellowship that you do. Cleft and cranial facial surgery involves repair of cleft, lip, and palate, what is called distraction osteogenesis for people who have congenital conditions that need altering of their bony structures, and then cranial vault repositioning. Most cleft and cranial facial surgeons who dedicate their practice just to the surgery do complete a fellowship, and most of them do work in academic centers and are part of a dedicated cleft and craniofacial team, which works with many other specialties throughout treatment of those patients. Finally, something that's actually pretty important and also kind of specific, I would say, to oral surgery is facial infection. So we are kind of, in my opinion, of course I'm biased, but the experts in treatment of facial infections. As you can probably guess, a majority of the facial infections that you see are caused by bad teeth, infected teeth, that then go untreated and lead to significant facial infections. So there are many what we call spaces within the face. So an infection gone bad can spread to involve the airway, which is an acute emergency, one of the few acute emergencies that we do treat. and can go, I mean, in very, very severe cases, can even go up to the brain or down to the heart. So this is another field or within my specialty that most oral maxillofacial surgeons will see and treat regularly throughout their entire career. Implant surgery, this includes placement of dental implants used to replace single or even complete arches of teeth. Obviously, this is also gaining a lot of popularity in many medical and dental fields and specialties. It includes not only placing implants to replace teeth, but also augmenting the bone in order to do so, which includes sinus lift, block grafting to different areas of the face. And then finally, jaw reconstruction, most commonly due to trauma, infection, and pathology. And this has evolved tremendously over time, even over my short time as an oral surgeon. Through the use of what we call virtual surgical planning, we can now essentially plan our entire surgery from start to finish before even stepping into the OR. We can customize our resection and then our reconstruction, make custom plates, and have everything ready for us the day of surgery. So, and that's in many fields, but it's a really cool thing that, or part of oral surgery that's going to continue to evolve, I'm sure. So I thought I would take a slide just to talk a little bit about my journey. So I've listed here all of the cities and places that my journey, my medical training has taken me. So my journey really evolved over time. At first, after I graduated college, I thought that I wanted to become a dentist, so I went to dental school. I quickly realized that that really was not for me, and that I really loved medicine and surgery more. And there was a time when I even considered just going to medical school. But then I was fortunate enough to have mentors who introduced me to oral and maxillofacial surgery. And this was great because it allowed me to do both. And it also meant that I didn't have to waste all the time and money that I spent on my dental school education. So this is also why I exclusively chose to apply to 6-year oral and maxillofacial surgery programs that included the medical school track, going to medical school, obtaining a medical degree. So in brief, you know, I started off, I'm here in Cleveland. I am born and raised in Cleveland. I went to undergraduate school here at a small university here outside of Cleveland called John Carroll. Then I went to Boston University for dental school. I then spent 1 year at what is called a general practice residency, basically practicing hospital dentistry and oral medicine in Charlotte, North Carolina. During this year is when I applied to oral and maxillofacial surgery. That was my main goal in going to this program, was to kind of use it as a stepping stone to oral surgery. I then was very lucky to match into my #1 residency program, a 6-year integrated residency in medical school in Detroit at Wayne State and the Detroit Medical Center. I spent 6 years there. Then I, as I mentioned, went to fellowship, orthognathic surgery. I did 1-year fellowship in orthognathic surgery at Georgetown Hospital in DC. And then I worked also a 2nd year as a general surgery resident. I chose, that is definitely something that not many oral surgeons do. I did it just to improve my surgical skills in that area. And for me, I really enjoyed that extra training. I then moved to St. Louis, Missouri to do my 2nd fellowship, which is where I focused more on TMJ surgery as well as oculoplastic cosmetic surgery. I was very lucky to be able to work under one of the gurus in oculoplastic surgery in St. Louis. And then I stayed there and I worked in private practice in St. Louis for about 4 years. Before coming full circle, I returned to Cleveland last year, joining my group, both in private practice and with the residency program, like I said, here at Case. So that was my journey. And I listed these cities just to kind of show you how it's something that I think is very unique. And I find I was very grateful for the opportunity to be able to work and train and be educated and live and explore so many different cities. I think that is something that a journey throughout any kind of medicine or dental specialty can provide you, which I personally think is a strength. And it gave me, you know, an opportunity, which I'm grateful for, provided me with amazing experiences, opportunities, connections, and friendships. You know, many of my very close friends are still people that I trained with. We are all over the country now, but with the advent of, you know, the internet and things like these meetings, you know, obviously we can stay in touch even easier. So a little bit about my day to day. So I work 5 days a week, Monday through Friday. My days usually consist of a combination of consultations for surgeries, post-ops from surgeries, and then of course procedures, both either in the office or in the operating room. I typically work 8 to 5, so the typical 40-hour work week on average. Some weeks are longer than others, and they vary. Weeks that I take call or trauma call typically tend to be, I put in more than 40 hours a week. It's very common that on my call weeks that I work 8 to 5 in my office, then go down to the hospital to do a trauma case that came in, you know, a day or two previously. So like I said, so that amounts out to about 3 to 4 days in private practice, and then 1 to 2 days either in the operating room or working with residents in their resident clinic, or also in the operating room. And I've mentioned I take call, so I share call with 2 other surgeons in my community, sharing trauma call. When I say this means also, you know, working with the residents on those cases, and it averages out to about every 2 weeks for 2 weeks for every about 6-week period. So kind of to wrap up, you know, why OMFS? So for me, what keeps me interested in my specialty is really how it is a mix of surgery and medicine, which I love. I love the wide variety of cases that I get to treat. Also the opportunities to work with so many other medical, dental, healthcare specialties and professionals. The diversity of the surgical procedures that we are trained and proficient in really is also, you know, I spend a lot of time going over all that. To me, that's really another reason why I really love my specialty. Truly, no 2 surgeries are identical. And finally, on a more personal note, as an OMF surgeon, I get to regularly help reconstruct someone's face, which is the first thing that anybody sees. And to me, that's very humbling and also very satisfying. So that's my why. So now I will turn it over and we'll answer some questions. I have, you know, I was sent some questions, so I have those written down. I could start with those, or we can, you know, if there's other questions that people want to submit, however you'd like to do that.
We can start with your questions and then we can move on to the chat. I know there's like a couple in there. Yeah.
Okay. So the first question was, what made you consider OMFS? So I think I kind of went over that in my presentation. For me, it was just the combination of surgery, medicine, and dentistry too, which really, my passion was always surgery and medicine. I just love it. I love about it. So being an OMF surgeon really allowed me to do all of that every day on a daily basis. So, and what made me consider it is I was very lucky that I had oral surgeons during my dental school at Boston University that really encouraged me to pursue oral maxillofacial surgery. And especially, I will say, you know, as a female, even back then. So I was in dental school from 2001 to 2005, and they really encouraged me, said that we need more females in this field. So to me, that was very encouraging. I know that's a big obstacle for many females looking into any surgical field. So I feel very lucky to have had mentors like that to push me in this direction. So the next question says, what made you choose the schools you attended? So, well, my undergraduate school was here in Cleveland. As a high school senior, I wasn't quite ready to branch out too far from home. So I went to a small school, private liberal arts college in Cleveland. Ironically, I now live 5 minutes down the road from my undergraduate college after I moved back here to Cleveland. So from there, though, I did 4 years in a small school. I had a wonderful time, but I was ready to move to the big city, as I said. So I only applied to dental school out of state because I wanted to leave. And Boston, I fell in love with Boston like the first time I was ever there. And really for me, that was probably the best part of dental school, was the fact that it was in Boston for me. I still have a great memories of that city. That was what got me there. From there, though, as any residency, it's part of a match process. So you interview, you apply to programs, then you're granted interviews, you interview at specific programs, and then you submit a match list. And conversely, on the other side, those programs are submitting a match list of their candidates, and then there's match day, and you find out where you matched. So for me, that was Detroit. So I, was kind of chose that, but it was kind of like not 100% my decision. But again, it was my top choice, so I feel very for that. And Detroit, I'll be honest, I never would have lived in Detroit otherwise. But I still have a very special place in my heart for Detroit, for everything that I learned there. The medical training, the dental training, or the oral surgery training there was phenomenal. The case, there's so much pathology there. There's so much different kinds of variety of cases there. And then I chose to do a fellowship. I went to DC, like I said. That obviously was my choice. I feel so lucky to have lived in DC for 2 years. I probably would have never lived there otherwise had there not been a fellowship opportunity there for me. DC is an amazing city, especially if you're into history, which I happen to be. So getting to take my normal jog down to like the National Mall, to all the memorials was actually, pretty cool. And then finally, I choose to take a job in St. Louis. It was for the job. It was a good fit for me. I would have never thought about ever moving to St. Louis, or didn't know anything about St. Louis. But again, it's one of those places, it leaves a mark on you. I spent 5 years there. My significant other I met there. So I definitely have a special place for St. Louis as well. So that kind of was a long answer, I know, but that just kind of went back to kind of what I said in my presentation about how I feel that a career in medicine or dentistry or surgery or whatever really can provide you with the opportunity to explore many different places, which to me, I think that's a huge advantage for just a life experience in general. So, all right, moving on. So what are the main stories behind your patients? For instance, post-trauma, cosmetic. Well, I'll do the trauma. So, obviously there's a lot of stories that come with trauma. There's a lot of different mechanisms of injury. And it's interesting, a lot of it's very regional, so it will change. In Detroit, a lot of gunshot wounds. people, unfortunately, I mean, that's just what happens. A lot of people shooting other people. Whereas when I went to St. Louis, well, in Detroit, you know, most training programs are in like downtown, like very urban inner city areas. And that's where my hospital was in Detroit. When I went to St. Louis, I was in more a suburban St. Louis hospital. It was a level 1 trauma center, but we saw more motor vehicle accidents there. It was Missouri. Missouri is very country. We saw a lot of ATV accidents. I did not treat very many gunshot wounds in Missouri at all. You know, for me, probably one of the most, you know, sad or hard stories or people to treat actually are people or self-inflicted gunshot wounds, you know. So obviously that goes, the explanation for that speaks for itself. Just a couple weeks ago here in Cleveland, we treated an attempted suicide, and you know, those are always very hard patients to treat, because obviously there's a lot more that goes on beyond just you know, putting them back together, which is what we do. So the other story that I will say, story behind my patients that I really like, and again, because I did a fellowship with Orthognathic jaw reconstructive surgery, those patients, I love that surgery because it's so life-changing for everybody. A lot of the patients, it cures their sleep apnea. Some patients have never been able to chew or talk properly because their jaws are maligned. So to me, that's just always very satisfying when the patients come back. And it's a long journey. The surgery is not easy, the recovery is not easy. But when patients come back and say that despite how difficult it was, their results are so life-changing that they would do it all over again, that's very, obviously, very satisfying for me. So next question. How to be patient and motivated during medical school, dental school, and residency. So obviously, medical school, dental school, and residency are very challenging. They're very demanding. So my best advice is that you really have to be able to detach and compartmentalize. You cannot be 100% of the time, all day, every day, school, residency, only surgery. If you do, you will burn yourself out before you even have a quote unquote real job. So you just need to take breaks. You need to make sure even if you have to, you know, surgeons especially, many of us are very type A people. So we thrive on schedules. I am the same way. So if you need to schedule in time to relax, time to unwind and just disconnect, I always recommend, you know, you have to step away where you don't think about work. Do not take work home and do something else, whatever it is that you like. For me, exercise has always been my release. So I always made time to exercise. I mean, even throughout residency, I probably exercised 6 times a week because that was my way of staying motivated and getting through it, and refreshing myself. So that would be my recommendation or suggestion. Next question. Would you ever want to practice in another country? If so, where? Oh, this is an interesting question. I've never really considered practicing in another country. I did go to Guatemala on a medical mission trip as an alternative spring break, it was called, during my 2nd year of medical school. So that was very, a very interesting, you know, experience for me. Something that I have wanted to do, have not yet done it, but it's definitely on my bucket list, is to do a mission trip to other countries. That's something I want to do. But to specifically answer the question, if I was going to practice somewhere else, I would definitely want to practice somewhere in Europe, because I find Europe fascinating, and I would love to live somewhere in Europe. And I'm from Italy. I have Italian heritage, so maybe one day I'll practice in Italy. I think that would be pretty cool. All right, what are your thoughts on dentistry and medicine overseas? So I think we learn a lot from our international colleagues, and most interestingly for me, through this whole kind of like social media journey now, that is something that when I was a resident or a student was not even a thing, which is probably good and bad for many reasons. It has allowed me to connect with so many other surgeons and doctors within my specialty and other specialties abroad, and which is just, I mean, I've learned so much from them. So, I mean, I love the collaborations. I would love to learn more about, because even especially my specialty, you know, like I said, different countries, there's definitely different routes to go. I know in the United Kingdom, becoming an oral maxillofacial surgeon is very different from what we do here. So I would love to see sometime in the future American residency programs include an overseas or international rotation. I think that would be very, very valuable. I think it's a great collaboration possibility. All right, what kept you motivated throughout your journey as a student and doctor? So a little bit, I touched on that, you know, making time for yourself, that's important. But for me, my biggest motivator was always the friendships and the relationships that I made throughout residency. You know, believe it or not, like my 6 years in Detroit went by very quickly. And that was mainly because I, you know, enjoyed the people that I worked with. Some of my medical school classmates, we graduated and we went together to be surgery interns. When you're working, and you do work as a resident, you work 100, you know, 80 to 100 hours a week on average. It's very normal. When you're working that much time with people, you know, you really get to know these people, and it really is a team effort. That's what I would say that I miss the most about, you know, residency, is not having that team, that camaraderie. And obviously there was definitely people that I did not care for, that I did not get along with, and quite frankly, I did not like. You know, but unfortunately, you know, or fortunately, there was always more people that I liked than I didn't like. And that having that support system of people to kind of commiserate with, who are going through the same thing as you, you know, it kind of gives you that motivation to keep going and to just, you know, not avoid those like toxic people, and just, you know, don't pay any attention to them. I mean, unfortunately, anything you do, you're not going to ever get away from toxic people. You just have to learn how to decrease your interaction with them and just kind of move around them. So for me, like I said, the camaraderie of the people that I worked with, and then also, you know, just working, you know, you're working together to treat people. You know, people have put their trust in you as a doctor to cure them of something or do surgery on them. And, you know, that's very powerful too. Never, you know, I've never forgotten that, the fact that people put trust in me, you know, to cut on them. That's very motivating. So, all right, what is a piece of advice you would give your younger self? So, I've been asked this a lot. I would tell myself to laugh at myself more and to not take myself too seriously. Looking back, especially as a resident, I was very serious and I took a lot of things personally. Now, obviously, that's easier said than done. And there are times when things will be personal, and, you know, you have to, you know, deal with that. But for the most part, when you're in residency, everybody's there to train you. And for the most time, you know, it's hard to take criticism no matter what. But people are doing it to help you learn, to make you a better doctor, surgeon, to succeed. Because one day, and it seems like it's like so many years in the future, but man, does it come pretty quickly, you're going to be there by yourself. You're not going to have anybody to, you know, back you up. You're going to have to make those decisions. Just try take yourself lightly and laugh. I've definitely learned to laugh at myself more in the last 5 years. And to me, I definitely can see that it decreases my stress on a daily basis. So that's good. How was your dental / medical school experience? So I'm, OMF surgeons are quite unique in the fact that many of us have had both experiences, which, not many people are crazy enough to do that, quite frankly. To me, I felt like actually dental school was harder than medical school. I have 2 theories for that. Number one, I think whatever you do first is going to be harder. And if you're doing something the second time around, you learn from the first time around and don't make the same mistakes. And 2, for me, like I kind of alluded to before, for me, medicine, I just really had a stronger interest in medicine than I did in dentistry. So for me, medical school was I loved it. Like, I absolutely loved learning every day. I felt like it was an honor to be able to learn this. So, but I enjoyed both experiences. Again, the biggest thing for those experiences is time management. From wherever you're coming, an undergraduate, or some people, non-traditional, they've been working and they go back to school. You really have to determine what is the best way for you to manage your time, and then what is the best way that you learn. Okay, these schools are very competitive. There's no way to 100%, get away from the competition of high scores and honoring and this and that. But you have to know what works best for you, and you're the only person that can know that. And to the best of your ability, try not to compare yourself to others, because your best friend may do this, and this to study, but that doesn't work for you. So don't get discouraged on, this works for that person, I have to do it that way, because that is, not true. You have to do it your own way. So, and then reach out. There's always people, to help you. These schools, they want you to succeed. They really do. So if you're struggling, there are so many people, there's so many resources within a professional school that you can reach out to. So it's always better to reach out sooner rather than later. So that's what I would encourage anybody to do if they find themselves struggling a bit or just questioning something. All right, what do you love about being a doctor? I think we've talked about that a lot. I mean, for me, it's just, all of us, we generally like to work with people. We like to help people. We like to see people happy and healthy. I like working with people, but I also like the exhilaration of being in an operating room and being able to, cut into somebody and then sew them back up. So to me, it's a privilege. Every day is a privilege. I'm so honored and grateful that I've had the opportunities that I had to pursue this career and to do it every day. So what is your most interesting surgery story? I think that I kind of answered that earlier. I can't think of a specific surgery story. I mean, I see a lot of trauma. It comes in many ways, shapes and forms, and every surgery is interesting and exciting in its own way. But I don't know. I guess that's not a really good answer for that. But that was the last question that I had written down that was submitted. So if there are more, I'm happy to answer them.
Yeah, there are a couple in the chat box, I believe.
Yeah. Let's see. How do I find the chat box?
I can tell you the questions I've pulled up. The first question is, what kind of facial trauma do you usually see?
So the top 3 I would say are gunshot wounds, motor vehicle accidents, and then fist fights. So there is an interesting story about facial trauma. So most people, if you have your jaw broken, because your face, your jaw, your upper and lower jaw, if you're in a fist fight and you're at the bar at the end of the night, someone's fighting over a girl or something like that, they get into fist fights. Well, most people get their jaws broken on the left side of their face. And that's because the majority of people are right-handed. So they throw a right-handed fist and they throw it to the left side of the face. So that's kind of a fun little party fact that you can bring up the next time someone asks you a question. So, but yeah, those are the top three: fist fight or motor vehicle accidents, fist fights, and then gunshot wounds.
Were you able to find the chat box?
I don't know. So how do I need to get out of my screen? Oh. So, yeah. Oh no, I don't want to do that. Stop share. Okay, I'm going to stop sharing. I think I stopped sharing, so let's see. Now I'm able to now I'm there. Okay. So I got it. Shout out to Cleveland and CWRU. All right, thank you. That's awesome. What sparked your interest in specializing in OMF surgery? Again, like I said, when I went to dental school, I mean, I'll be honest with you, I didn't really know what I wanted to do. No one in my family is in healthcare at all. So I really didn't have any role models in that way. So I kind of was like, someone was like, oh, try dental school. So I was like, okay. And I did. Then I got there and I was like, I couldn't see myself being a dentist for my life. So when I was introduced to oral and maxillofacial surgery, which I will admit, I probably had no idea what it was when I entered dental school, and had no intention of pursuing it. But when I met a couple of the oral surgeons at my dental school at Boston University, again, I know I said this, I feel very lucky that they were so encouraging, males, especially to me as a female student, to pursue oral surgery. So I just kind of took that and ran with it. And like I said, I feel very lucky that the specialty exists, and now I have a career in it, and I get to do it every day. So how did you know that becoming a dentist wasn't for you? Well, I guess I kind of answered that, but I mean, just for me, my personal interests were more really with medicine. And when I say that, like, I enjoyed dental school, but I enjoyed the content of medical school, hands down, 100% more. And I still do. Also, dentistry is I respect all dentists everywhere, and I obviously work with them on a daily basis. So it's very, very detail oriented, which surgery is as well, don't get me wrong. But in a very small space, a tooth is a very, very small structure. So you really have to know a lot about, like, biomaterials is a big thing in dentistry. So, like, for instance, like the materials that you use to make fillings, to do crowns, dentures, and all of that stuff, really just wasn't for me. Like, I didn't really get excited about that. So again, for me, oral and maxillofacial surgery is just awesome because I still have my roots in dentistry, which I use every single day. And then I get to use, incorporate surgery and medicine. And it was just a perfect, outcome for me. So, and I didn't have to throw away all the money that I had already put into dental school. So that was helpful too. Did you ever get discouraged during many years of school? And if so, how did you stay motivated to continue? So, of course, everybody gets discouraged. I'm the first to admit I did not pass every single test ever. And that can be discouraging. I think the biggest thing is just always to look at the end goal. There's always going to be bumps along the road, as they say. A bend in the road is not the end of the road. Having a good support system is very helpful, be it family, friends, spouses, significant others, having people to, talk to, definitely is very helpful. And just knowing that if this is, really what your passion is, what you really want to do, that's motivation in and of itself. If you find yourself, not enjoying what you're learning or not enjoying what you're working towards, then, that's a sign that maybe, you should rethink things. And then also just making sure to have fun. I mean, obviously not too much fun. Don't be crazy, but, both in dental school and medical school, there were plenty of social gatherings. There were plenty of, parties and different things like that. And I mean, that is important. You need to take time away where you disconnect and don't think about school. Because if you think about 100% of the time, I think it's very hard to stay motivated. So, and there's a lot of, all schools have extracurricular programs, different things, for you to get interested in. Like I said, I went on a medical mission trip during medical school, and I gained a lot of experience to that, not only in medicine, but also I got to know some of my medical school classmates that I otherwise probably would have never even known existed. There's a lot of ways. All right, let's see. What were some of the struggles you had along your career pathway? How were you able to overcome them? Any advice for some of us in undergrad? The struggles, like I said, was, along the way, I did not pass everything. There were even board exams that I had to retake in dental school. And that is very humbling. So how I was able to overcome that is, number one, you have to, it's like going through any grieving almost. You have to accept that your disappointment, and really, don't overlook that. You also have to then accept that you are not dumb, or you're not a failure, that this is actually very common. And then you have to commit to, getting back up and putting in the effort to get a better outcome the second time around. And I truly believe that if this is your passion, if you want to do it, you will eventually succeed, no matter how many times you have to do it. And advice, like I've said, reach out to people, especially in undergrad. Like when I was in my undergraduate, I was part of a pre-dental group of students who were applying to either medical school or dental school. So I'm dating myself. It's been like almost 20 years since I was in undergrad, so I don't remember what we exactly did in that group. But it is, again, it's a support system. Especially if you're preparing for the MCAT or the DAT, the entrance exams, you have a group to study with, to bounce ideas off each other, and just to support each other. Also, I tell everybody, if you're interested in any type of healthcare field, reach out to people in your community, and shadow them. And of course, I know this is a lot harder during times like this with COVID and everything. In-person shadowing is, hopefully we're getting back to that. Even virtual shadowing, I know, is a thing. It's not the same, but you can still, I still think that there is value in even just talking to other people in the healthcare profession, even professions or specialties that maybe you aren't interested in, but it's always good to have a lot of perspectives, a lot of ideas from other people, because everybody's got a different experience. You will have a different experience. Like I said, I think that's very valuable. Also, if you make these connections with people, there are always possible letter writers for you, because when you're applying to any school or residency, you're always going to need letters of recommendation. And no matter who is writing that letter of recommendation, is always better if that person has a really good, if you have a really good relationship with that person and they really know you as a person. I mean, some of the letters, they're required to, you have to have the dean of your school write a letter. So obviously the dean of your school, you're not probably going to know too well. But the other letters, that are required, if even if they're not, say, for an oral surgeon, I say I had a different type of surgeon write me a letter. If they really knew me and knew my work ethic and are able to explain that in a letter, that type of letter is going to have a lot more impact than a generic letter from someone who is, that you don't really know, but they're in your specialty. So I hope that answers some of your question on that. And that is the last question that I see. So if anybody has any other questions, definitely happy to answer them. Reach out to me. I met you all through Instagram, so please reach out to me. I can, if you don't know, I can put my handle on there. I do regularly try to answer my DMs. So if a question comes up, please feel free to DM me. I will definitely, do my best to get back to you and reach out to me with any questions. All I can say is that I know these times are very difficult and unprecedented. None of us were kind of prepared to be in a world like this right now. But I give groups like and organizations like yourself just so much credit for making the best out of this situation and not giving up on what you've committed to and eventually becoming doctors. So and I am here to help any way I can. So
thank you so much. If there's no further questions, we can begin to wrap up. But thank you so much for taking time from your busy schedule to talk to us. That was some awesome question and answers. And by the way, Anaga has linked the quiz link, so please fill that out when you get time. But thank you so much, Dr. Tomsic. That was a great presentation.
Well, thank you all, and I wish you all a fabulous weekend.